contribution of the pharmaceutical industry to our health system is an absolutely vital one. The relationships that your industry have with our regulator MedSafe and our procurement agency Pharmac are also important, even if sometimes they give rise to healthy tensions. In the end, I think we all agree that your owners and investors and your armies of brilliant clinical researchers and our clinical administration professionals want the same thing: modern, effective, safe treatments that extend and improve quality of life. When we each keep our focus on that objective, the natural points of tension are easier to manage.
We're going to talk a lot tonight about patients, and we tend to just mentally put them in a different category, like they're not here. And they are all here, they're you. Whether you were a patient, whether you are a patient, or whether you're going to be a patient, this is very personal. This conversation about how we build health systems with genomic science is all about each and every one of us, and I wouldn't like us to sanitize it by considering it as a separate group of people.
So I don't have a horse in the race, if that makes sense, but I'm very interested how we all come up to the start line together and run. And for us, it was about understanding how we were going to invest Queensland Government's $25 million over 5 years to accelerate the adoption into everyday care. And for me, everyday care was about how our health system worked in reality. It was important that we connected the department, the hospitals and the universities together.
In New Zealand we do a lot of genomic medicine research that is done overseas, but it tends to be small scale, short 3-year cycles, relatively unsustainable. But it is being done.
From our point of view, from my point of view, I think it's now happening. It's now a race. People are adapting, and the minister spoke at length, and as you would expect, about equity. And I think we have to get on the boat, and we have to pedal like hell, because genomic science and genomic medicine is coming, and it will come as either something that is for everyone or something that is for the wealthy, but it's coming.
Right now we know that there's a particular gene that 20% of our population in Ngāti Porou have that inhibits the uptake of metformin. We've known about this for 3 years. It's not being utilised, in healthcare. It hasn't been translated into healthcare yet. There are bottlenecks, and it's really frustrating to be engaged in this research. And our whānau are saying, so what's happening now? What's the update? And we're unable to say anything. There's actually no results being, seen at the
It will happen one way or the other. My experience in the digital health program in Australia was I couldn't see a way where the health system wasn't going to become digitised. It was just a matter of how painful and expensive we wanted to make it to get there.
Take the top 50 companies in the world by research and development spend, the top 50, then 15 of them are pharmaceutical companies. And if you look at the way we can develop research to attract funding into Australasia generally, then there is not just a health opportunity there's an economic opportunity.
On the economic side, of course, we're not going to reap the benefits of a genomics industry, are we? We are going to really miss out, and we will be exporting the value from our genomics. Our best and brightest will probably go overseas. We won't have a genomic medicine infrastructure that fosters the genomic medicine for patients of tomorrow through research. And it's always cheaper to do medicine if you've been involved in developing the technology than if you have to buy it in.
The search for new treatments and cures is as unrelenting as the demand from patients and health professionals to have them. The technology of medicines is developing to such a high degree of sophistication that it's increasingly a challenge for health systems to keep up.
We need to have a great framework and a strategy that creates collectivism and collaboration and partnerships and a better and broader understanding of genomics beyond medicine into economy and society and those elements.
For our iwi, we were mandated, our hauora was mandated to look after and protect the data of our people. And so this is another bottleneck that we've identified, in the sense that we have had agreements, kaitiaki agreements. We've developed extra layers with the university to store our data there, our whānau's data there, but there has to be a long-term solution, and this is why a national framework is really essential.
Because sometimes this argument devolves back to cost and money, but what Cris is saying is absolutely right. But if you can, what you can also do with genomic testing is exclude treatments from patients and not waste their time and not waste government money by treating them with things that clearly won't work.
The way I visualise it is like when you see a flock of birds that are starting to fly, they're just getting into formation and just getting organised, and I think that's about where we are in New Zealand with genomic medicine.
If we do nothing, then the wealthy will take it up. They'll get on planes and boats and trains, and the rest of us will suffer. So I think it's time to look at it as an opportunity. It's like daylight and it's like summer. I believe it's coming, and we have to get ready.